Hello, and welcome to 15 News. Greetings, my name is Rucira Rubiati, and I will be accompanying you for 10 minutes forward. Our story today is about the virus that has been among us since March 2019, which is almost 3 years since the first case in Indonesia. And today, we will be interviewing some of students and a doctor who have been dealing with COVID-19 and will be telling us about how we can avoid getting COVID-19 by doing a healthy and clean behavior. Shortly, we will be going live to our reporter in the area. I'm connecting to Aulia, who is now in Bandung Islamic University.
Thank you, Rucira. Hello everyone, my name is Aulia and today I'll be reporting from Bandung Islamic University area. And here I am, already accompanied by students and doctor from the university. Hello, please introduce yourself.
Hello, I'm Daya, second year student from Medical Faculty of Bandung Islamic University.
Hello, I'm Fatin, first year student from Medical Faculty of Bandung Islamic University.
Hello, I'm a Dr. Ivania, a doctor and also a lecturer in Bandung Islamic University.
Nice to meet you, Doc. Thank you for sparing your precious time despite your busy schedule, I suppose.
It's my pleasure to help.
Okay, now I'll be asking some questions related to prevention of COVID-19 by doing clean and healthy behavior. So, do you know how's COVID-19 condition in Indonesia lately?
As far as I know, it's been so much better than last year, but unfortunately it's not completely gone yet. Some of my friends and family still have COVID and currently on quarantine.
I have been watching some news and read some newspaper, and thankfully, the cases have been gradually decreasing.
Yeah, right. Do you know what caused it to happen?
Averagely, Indonesian people still take the situation lightly even though there are still lots of people that are infected. At first, people are still obeying the COVID-19 protocols because they are still scared of how high the infection rate is. So, unfortunately, since it's already decreasing, people start to forget about the protocols.
Talking about the COVID-19 protocol, do you still remember what the protocols are?
Of course I do. It's basically about clean and healthy behavior. I've actually been doing it even before the COVID-19 situation.
Well, I have known some of them, but honestly, sometimes I'm too lazy to obey the protocols. I feel that it is too tiresome for me to do it.
Okay, you said you know about the protocols. So can you explain some of them to me and the audience at home?
In this COVID-19 situation, I focus a lot on maintaining cleanliness after going outside by washing my hands, as well as when I'm outside by using hand sanitizer if there's no water and soap yet available, and also to make sure to keep a safe distance that are regulated with the protocol. The best one, I think, that could keep me and my family safer is to minimize our mobility, so we could prevent any contact from the virus. And of course, obviously, wearing masks everywhere, just like how we do it until now.
Well, actually, I have ever got COVID-19, so I'm currently relearning about the protocols. Because even though the protocols are made to prevent getting COVID-19, it apparently helped to prevent the virus to spread, and also to get rid of the virus itself. I try my best to do hand washing method every day, to take better care of myself by eating good and clean foods, drinking enough water every day, exercise more, so I could increase my immunity and minimize the risk of getting infected again.
I'm so sorry to hear that. Hope it can be a lesson not only for you, but also the people that watching us. Speaking of lesson, we've prepared a little video that tells us about clean and healthy behavior that perhaps can help you and the viewers at home or anywhere that currently watching this, you have similar difficulties to understand and do clean and healthy behavior. I'm connecting back to Rucira in the studio.
Thank you, Aulia. Well, everyone, as my partner said earlier, here we have a special video for you guys about clean and healthy behavior that related to COVID-19. Hope it helps. COVID-19 is an infectious disease that can be spread through droplets. When it infects the human body, it can spread as fast as a flash. So the infection can also spread really fast. It's obvious that the important thing that we should do to prevent the disease to get worse is to prevent it to happen by minimizing body contact and always keep our own hygiene.
Things that we can do to prevent it are included in what we know as 5M, that if translated in English, consists of using mask, washing hands with soap, maintain distance from each other, avoid crowded places, and maintain mobility. Plus, now it's useful that the government has enforced the implementation of public activity restrictions, familiarly known as PPKM, to minimize physical contact. They also require other people to be vaccinated, and of course, all of this will greatly help to reduce the risk of exposure to COVID-19.
Here are some simple but yet important things that you can do to prevent the spread of COVID-19. Washing hands with soap and running water is one of the best ways to kill bacteria. But if it's not available, you can also use 60% alcohol-based hand sanitizer instead. In a good hand washing, there are 6 steps that needs to be done. First, pour the hand rub liquid on your palms, then wipe and rub your palms gently in a circular direction. Second, wipe and rub back of both hands alternately. Third, rub between your fingers until it's clean. Fourth, clean the fingertips alternately with interlocking position. Fifth, rub and rotate your thumbs alternately. Sixth, place your fingertips in your palms and rub gently.
The government's appeals include maintaining physical distancing, working from home, studying at home, and praying at home. This is done because the transmission of the COVID is very easy, namely through droplets. Here's how to apply physical distancing. 1. Avoid shaking hands and hugging when meeting people who are not at home. 2. Avoid gathering in large numbers. 3. And also keep your distance from people around you for at least 1 meter.
And even nowadays, sneezing and coughing is a scary thing for many people, because from this incident, many body droplets can be released. Plus, coughing is the main symptom of COVID, which is very easy to see. Although, not every cough is the main diagnosis of COVID. So to prevent and minimize this, when we sneeze and cough, we cover our mouth and nose with our arm, closing them like this so that people around us are not exposed to the splashes of the saliva. It's better to use a tissue when covering your mouth and nose when sneezing or coughing. And things to pay attention to are to avoid touching the face area. The coronavirus can attack the body, especially through the triangular areas of the face, such as the eyes, mouth, and nose. The triangular area of the face is often to be touched by hands, conscious or unconsciously.
Hello folks, back again with me in this beautiful area and accompanied by our lovely doctor here, who's gonna tell us her opinion about our previous clip, and also relate to how is the effect of the protocol and how is it done if it's in the hospital. So Doc, can you tell us about it?
Absolutely, honestly, the clip is so good. It has the main point, but it's so simple to understand about the clean and healthy living behavior. It tells us the right step of how we can prevent the COVID, and for the effect itself, how the virus spread really depends on how people running the protocol. If they take it seriously, then the effect will be good because the virus will be hard to spread. But if they take it lightly, it will give the virus an easy path to spread, so everyone will get infected easily. Like in the hospital, there are many people that are sick. It's place they are very prone to viruses, so it needs double safety, such as wearing double mask, a special uniform that designed for the doctor and nurse, known as personal protective equipment, that they need to always wear while in the hospital. Even there are some doctors who wears electronic masks. The state protocol and enforce nothing but for the safety of the people.
So for the last part of our amazing conversation, is there a message that you would like to share regarding the clean and healthy living behaviors COVID protocols for all of us?
Always wash your hand after or before you do anything.
Always wear a mask when you are outside the house and don't be lazy to follow the COVID protocols.
Keep your distance and avoid contact with other people. If there are any symptoms of COVID, please come to the hospital to be checked immediately.
Okay, then we can conclude that we should always wash our hands, wear masks, and keep our distance, right? Okay, So thank you for your time, doctor, as well as the student who has told us all about the clean and healthy living behaviors COVID protocol. That's all from me. I am Aulia, sending back to Rucira who is in the studio.
Thank you, Aulia. And also thank you to the doctor and students who have taken the time to provide information regarding the clean and healthy living behaviors COVID protocol. Ladies and gentlemen, that information also close our togetherness in today's event. Me, Rucira as your presenter, will accompany you in another time. Good night, and I'll see you back on 15 News.
From this video, there are many lessons that we can take. For example, if we connect it from Islam perspective, Rasulullah SAW strongly recommended to his people to always maintain cleanliness. Cleanliness is also a part of worship. For example, when you want to perform prayer, one of conditions for a valid prayer is absolution or purification from uncleanness. Establishing prayer should also be done in clean place. Thank you.